Dr. Kimia. Today I want to show you an alternative exercise to the foam roller thoracic mobility. You may all have seen people at the gym kind of rolling their back with the foam roller extending backwards against it. What I find with this exercise is that some foam rollers are really hard and it makes it difficult for the body to relax. Second of all, when people typically tend to extend over the foam roller, they have their rib cage flared up like that. So a lot of the time you're actually not targeting the mid-back for mobility, but rather you're getting a lot of rib cage flaring, which defeats the purpose of the exercise. So today I want to show you an alternative to this exercise that might work a little bit better for you. Alright, so I've got my model here. You can use a rolled up yoga mat or a rolled up bath towel. Anything kind of with this shape will work. And you want to start you can either start targeting where the area is feeling the most stiff, or you can just kind of work your way up from the mid-back area all the way to the top. So we're gonna do Taro. Taro typically tends to have a little bit of a rounded shoulder posture and more of a curvature in his thoracic spine. So for him, it's usually around kind of T6, T4 to T6. That's usually the most restricted. So that's where we're gonna target for him. So I want you to lay on this towel, place the center of the towel kind of around this spot for you. Okay? Good. Great. Okay, so wrap your hands behind your back. Good. First of all, what you want to do is tuck your chin in. Make sure you don't let go of this posture. You're going to slowly let your head down and lower your head, but keep your chin tucked as best as you can. Good. And just let the towel kind of push against your back. Good. And then whenever you feel like you can place your head down, then go ahead and remove your hand and then just open up your hands. If you have a patient that has the more difficult time with this kind of neck extension position, you can always give them a little bit of a help by propping up their neck with a pillow like this. And it might just make it a little bit more comfortable for them, especially if they have chronic neck pain issues. From here, you want to pretend like there is Velcro attached to all parts of your arm and shoulder. So I want you to, maybe about just 10% effort, push your shoulder, your elbow, and your hands into the ground, and make sure that it stays like that throughout the exercise, as well as the chin tuck. Make sure that your chin stays nicely tucked there, okay? Then you want to focus a little bit on breathing here. You can see the rib flaring a little bit happening, but that's what we're gonna work on next to make sure that he can control this extension in his thoracic spine without having the rib cage flare so much. So now we're gonna focus on breathing. We're gonna breathe in for breathe in for 4 and exhale out for 6. So go ahead. And exhale, 6, 5, 4, 3, 2, 1. If your patient isn't familiar with the breathing much, you might notice that they let their exhale out a lot earlier, but it takes a little bit more practice. They'll get better and better at it. Go ahead and breathe in, 4, 3, 2, 1, and exhale, 6, 5, 4, 3, 2, and 1. One more time, inhale, 4, 3, 2, 1, and exhale, 6, 5, 4, 3, 2, 1. Good. Keep your breathing here. Keep the breathing going. You know, you can be a little bit more shallow. You don't have to go all the way with deep breaths in and out. Now I want you to just gently lift your pelvis up from the floor. Pretend like there's a string attached at the bottom of your hips and is pulling you away from your head. So elongate, elongate, elongate. Good. And then gently place your bum down again. And repeat with the breathing. So you're gonna breathe in, 4, 3, 2, 1, and let it go, 6, 5, 4, 3, 2, 1. Better exhale this time. And lift up with the hips. Nice and elongate. Keep elongating. Pull, pull, pull. And slowly bring it down. They can choose to keep their knees bent or while doing the breathing, or they can have their knees straight. Whichever is more comfortable for the patient is okay. Typically having the knees bent will probably make this exercise more comfortable. Okay? And then you repeat this a couple times. You'll notice as you elongate, the towel kind of pulls up and tractions your back a little bit as well. So, or you can just move your body and manually place the towel to a different spot and target mobility at a different part of your thoracic spine. Give this exercise a try. Let me know if you have any questions. Consult with your practitioner for the number of reps and sets that's appropriate for you, and hope you enjoy.